Olá, pessoal, boa noite. Sejam bem-vindos para mais uma aula aqui no canal. E hoje nós vamos falar sobre OET. E eu estou trazendo um convidado muito especial aqui, que é o Jack Was. Ele é Education Specialist na OET, então ele é um insider. Ele vai trazer insider tips para gente, então vai explicar tudo sobre o exame, contar como o exame funciona, vai trazer estratégias de sucesso para vocês conseguirem arrasar no exame. Então, fiquem aqui comigo e se você está assistindo essa aula gravada, vá até o final, porque é a última aula que nós tivemos aqui com o Jack, que foi sobre writing, teve muito conteúdo complexo, denso, mas ao mesmo tempo simplificado por ele, que sabe explicar muito bem sobre o exame. E então você pode assistir até em velocidade mais alta, mas tenta não acelerar muito, porque tem muito conteúdo e vai ser mais fácil você absorver se você conseguir, né, assistir até o final e em uma velocidade perto do normal. Mas nós temos alguns alunos aqui já, temos a Sheila. Hello, Sheila, good evening. E deixa eu ver, temos mais gente entrando aqui também no meu grupo, a minha turma que está falando que vão entrar. Então vamos começar, vamos dar início a essa conversa com o Jack. Sheila, depois eu quero saber das novidades, viu? Mas deixa eu trazer o Jack aqui. Hello, Jack. Good evening. How are you
Hello,
doing?
good evening. Good. How are you?
Good too. Very busy, but good. And how has the start of the year been for you?
It's been good. It's been good. Very busy after the holidays, catching up on everything and getting back into the swing of working and emails and meetings and everything. But it's been good.
All right, great to hear that. And it's a pleasure to have you here once again. Thank you for making the time. I know how busy you are. And what are we talking about today?
Today we are talking all about OET speaking. So we're focusing specifically on the speaking subtest. So we're going to learn about what is made up of the speaking test, some strategies, some tips, and ways that you can improve your speaking before your test date.
All righty, so you can start if you're ready.
Okay, perfect. I think we just need to bring the presentation into view. Add it to the there we go. Perfect. Wonderful. Okay, so let me go ahead and get started. So thank you everyone for participating. Again, my name is Jack Waz, and I'll be talking to you all about OET speaking today. So to get us started here, I'm just going to show you the agenda. Let's see, here we go, the agenda. So for the agenda, we're going to start out giving you an overview of what is OET speaking. We're going to talk about scoring. We're going to be talking about 5 tips for OET speaking. And then we're going to look at a sample role play extract and finish off with some useful tools and some Q&A that you can use for speaking. So that's kind of all the things that we're going to be covering today. So let's start out with the basics of OET speaking. OET speaking consists of 2 5-minute role plays. Each role play is specific to your profession. So if you're a nurse, you'll play the role of a nurse. If you're a doctor, you'll play the role of a doctor, and etc. You'll also work with an interlocutor who takes the role of the patient or carer in each of the role plays. The whole test takes around 20 minutes. If you're taking OET on paper, your speaking test will be in a room and face-to-face with the interlocutor at the venue. If you're taking OET on computer or at home, you will complete the speaking test online with the interlocutor on a secure version of Zoom. If you're taking OET on paper, your ID check is basically a check of your passport or valid ID. For OET on computer or OET at home, these are done including some extra security checks, such as a check of your room and showing your person, such as showing the interlocutor your wrists, ankles, glasses, and so on, to ensure the test environment is secure. Then there's a 2 to 3 minutes warm-up. Here, the interlocutor asks you some questions about your professional background. This is just to give you a chance to get comfortable with each other's voices. Then you get your role play card and 3 minutes to prepare for the role play. The first role play lasts 5 minutes. Then you get the next role card and another 3 minutes to prepare for the second role play. You'll be able to see the role card throughout the whole role play. Note that only your role plays are assessed, and this is not by the interlocutor. There are actually 2 separate OET assessors who listen to your role plays and rate your performance using the speaking assessment criteria, which we're going to cover in the next section of this session. So you're only getting graded on the actual 2 role plays, not the warm-up and not the preparation time. Now that we've covered the basics of OET speaking, let's take a closer look at the role cards. Now this example, just to show you, is for nursing. You can see nursing at the top. Each of the role cards has 3 sections. The first section is the setting, which give you clues about the conversation. Is it a routine or emergency health issue? Is the patient at home, visiting a clinic, or at a hospital? The next section is background information, which gives you relevant background details about the patient's age, the reason for the healthcare visit, and whether this is a first visit or a prior relationship. The background information also makes it clear if you are speaking to the patient directly or a relative of the patient. For example, if the patient is a child, you will be speaking to the patient's parent, and the card will say the child is not present in the room. The final section includes the tasks that you need to cover, which include instructions of what you need to say. The verbs tell you the function of your communication. So you can see verbs like confirm, reassure, explain, while the information in parentheses provides examples you can use in your conversation. So for example, it says emphasize injections are best option available. And then in parentheses, it says current management, not working, etc. So it gives you ideas of things you can mention to cover that task. Before we look at some skills for speaking, let's understand how your role plays are assessed. Assessors mark your performance on linguistic criteria and clinical communication criteria. Our linguistic criteria, determine how assessors will score your language skills during the speaking subtest. Do you know all the clinical criteria? For those that are viewing and are able to write in the chat, feel free to write these words that are missing for these 3 additional criteria. We have intelligibility listed, and there are 3 other criteria below. So try to think of what those criteria might be. Okay? Feel free to write your ideas in the chat. Otherwise, you can just think about what the answer might be. I'll give you about 20 seconds, and then we can go over this together. We can go over the answer. All right, so hopefully you've had a few seconds to think about your answer right in the chat. The answer is fluency, appropriateness of language, and resources of grammar and expression. For the OET speaking subtest, assessors give you a score for each of the criterion. This is called a band score. For these assessment criteria, the range or the maximum score for each of these is 6. So you can score out of 6 for these 4 criteria. What you're looking at is the linguistic assessment criteria and the descriptors for each band score. So you can see 6 at the top because 6 is the maximum score, and then it gives you what the descriptors are for all the other scores from 6 down to 0. You can find this document in the FAQ section of our speaking page. All right, so I'm trying to post a link to that later, but you go to oet.com/ready, go to speaking, and then at the bottom there's an FAQ section. That's where you can find these assessment criteria documents.
Yeah, and I think it is extremely important for them, like, to understand the evaluation criteria, because they can, like, understand where they are now and, like, what they have to improve to reach the grade that they need. And most of the times, students, they don't read the assessment criteria. So guys, from now on, promise me you take a closer look to this document. You will keep it with you and take a look every now and then to see, like, where you are now, what points you still need to improve. And yeah, but it's great that they have that.
Absolutely, it's a very good resource. The criteria also come with a glossary that explains the focus of each criterion. We want to recommend a speaking resource you should not miss. It's the Ultimate Speaking Guide. In part 1 is dedicated to the linguistic criteria, where you can find explanations, examples, including from a nursing role play, and tips to help you prepare. This is also on the speaking page. So it's called the Ultimate Speaking Guide, another great resource to look at. The second set of criteria you are assessed on are the clinical communication criteria. Can you tell me what all of them are? So again, give you about 20 seconds to try to fill in the missing words here, all right, and these assessment criteria. Okay, so let's go ahead and go over these answers. Relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. Now, just like the other criteria that we looked at, these also have a maximum band score, but these ones are out of 3 rather than 6, okay? And here you can see all of them listed. Assessors look at how you demonstrate the indicators under each criterion across both role plays. You should not treat them as a checklist to try to cover in each role play. They're just a guideline of what you're being assessed on. You're marked from 0 to 3 for each of the clinical communication criteria.
Então, só um minutinho. Sorry to interrupt you. So, guys, pessoal, vocês têm que lembrar que o grande diferencial do OET é que vocês vão não só fazer um exame, né, que vai avaliar o inglês de vocês de uma maneira geral para comunicação do dia a dia, como é o IELTS, o TOEFL. Não, vocês vão ter um exame que já é focado nas necessidades profissionais de vocês. So both your English and your professional communication skills will be tested. And I think this is very important for you guys who are planning to immigrate, to work and live abroad, because while you are studying for the OET, you'll be learning language that you'll be able to use in real life when you are interacting with your patients. And I think this is amazing.
Absolutely. Yeah, very, very great reminder. Okay. So like the clinical criteria, the clinical communication criteria have a glossary which explains each in more detail. And for this, we recommend our Ultimate Speaking Guide Part 2, which focuses on the clinical communication criteria. It's got plenty of real audio examples and tips to help you demonstrate the criteria. You should aim to achieve the highest level in the descriptors for each criteria. Test takers securing a grade of B will have achieved predominantly scores of 5 out of 6 on each linguistic criteria and 2 out of 3 for the clinical communication criteria. So those are the scores that you're looking for a grade of B. 5 ways to improve in OET speaking. So in this section, we're going to focus on 5 ways that you can improve in the OET speaking subtest. The first is to initiate the interaction confidently. This is all about getting the role play off to a good start, as first impressions matter. But first, tell me if this statement is true or false. There's only one correct way to start an OET role play. All right, so think about that answer maybe for 10 seconds. Here we go. I should be able to start this timer. All right. Hopefully you've had time to think about your answer here. So of course, the answer here is false. There's not only one way you can start a role play. So let's see more information on that. Let's refer to the speaking glossary for an explanation. Initiation involves greeting the patient, introducing yourself, clarifying the patient's name, and clarifying your role in their care. As part of the criterion, which is relationship building, this is kind of the information that's included. Okay, so in real life, the first words of any conversation with a patient could reduce their anxiety or raise it. This is why it's so important to begin all interactions in an appropriate manner for the context given in the background information. Now, let's try a task. On the left, you can see 2 introductions. Okay, or let's see. You can see 2 introductions. On the right are summary options of different situations. Take a minute to read and match the opening to the situation. Type your answers in the chat. And there's more than one answer as possible, so choose the one that you think is the best summary. So give me just 1 second here. Okay, so this is the first one. I kind of already showed you the answer for that. So hello, Jane. I can see you're in a lot of pain. I can give you something for that, but I just need to ask you some questions first. Is that okay? Now, if we look at the right, this opening can be described as C, urgent. This is an urgent opening, right, to the situation. So that's our first one here. Let's look at another example here. Second one says, hello, Jane. My name's Dina. I'm one of the doctors who's been looking after your daughter. I've come to give you an update and ask you a few questions. Is that okay? So let's take about 10, 15 seconds to try to determine what type of opening that would be. What's the best one that matches the description? A, B, D, or E? All right. So if we think about number 2, the answer would be D, an anxious parent. Okay, so that's what this opening would be described as. Now, here are 3 more openings. Complete matching them with the remaining situations. Comment on the answers in the chat if you're able to do so. Otherwise, feel free to write them down on a piece of paper. Starting your 30 seconds now, and then we'll go over the answers. All right. So let's go over these now. Number 3 says, all right, Mrs. Kim, now that I've examined your food, I'd like to ask some questions before we discuss treatment options. All right. This would be described as mid-consultation. So this is an opening from a mid-consultation. Next, we have, hello, Mrs. Kim. I'm Dina, one of the doctors on the ward today. How are you doing? That would be described as letter B, a first meeting, the first meeting with the patient. And the last one, hello, Jane. Thanks for coming back in today. How have you been since I last saw you? That would be a regular patient, right? This is something that's not urgent. This is a regular patient interaction.
So, Jack, I have a question that students often ask me regarding register. Can they be like more? We know they can be more informal if it's a regular patient, but is it also okay if they are a little like? Is it okay if they are a little more formal when they are seeing the patient for the first time? So, for example, using their last names instead of their first names.
They can be a little formal, but the main thing is to make sure to not use any technical language, right? That's the thing you want to really make sure of, because you want to make sure that you're being understood by the patient and things like that. So yes, obviously a first interaction with a patient would be a little bit more formal than a patient that you've seen over and over again. So that's okay to be a little bit more formal, as long as you're not using any of that technical language or vocabulary that might confuse the patient.
All right, so guys, you should always use the lay language, all right? Never technical language, otherwise patients can be confused and this will backfire, because sometimes they use technical language thinking like this is going to contribute to their score, but it's quite the opposite.
Absolutely. So let's try another task. This time, the setting and the background information are on the left. Choose the most appropriate way to start the interaction from the options on the right. Post your answer in the chat. So this is the background information. It's an emergency department. This is a medicine roll card. And it says, doctor, a parent presented 2 hours ago at the emergency department with his or her 4-year-old son. The boy had a 36-hour history of recurring vomiting and stomach pain, which was diagnosed as viral gastroenteritis. He was given oral rehydration fluids and observed for 2 hours. You have just told the parent that it is safe to discharge him. The parent seems anxious. So what is the best way to start this conversation? All right. Okay, so let's go over our answer now. The answer would be letter C. All right, Mr. Tran, your son is ready for discharge following your observations and his treatment. You seem a bit worried, though. Can you tell me what's concerning you? So that's based on what the background is and this information. The most appropriate way to start the interaction is with letter C. Now, for this final task, you tell me how you would start the same interaction. Type your answer in the chat. So here's, we have the same interaction. What's one way that you would think about to start this interaction? I'll give you 30 seconds. Feel free to write your answers in the chat or just think about them. All right, so hopefully you guys were able to write some ideas of how you would want to start this conversation based on the context and the setting and thinking about how you would really want to start this out. Well done. So let's go on to the second way you can improve your speaking, which is to elicit and explore. Let's go back to our assessment criteria glossary to see what this means. Here we see that we need to elicit and explore the patient's ideas, concerns, expectations as part of the criterion understanding and incorporating the patient's perspective. I'm going to play a short audio clip of a part of a conversation between a patient and a healthcare professional. Listen and tell me if the healthcare professional explores the patient's concern. All right, so let's see if this works. I'm going to try to play this, and if not, I can just read it. Were you able to hear that so far? Or was it not playing? I'll try. Here, let me try again. Is it playing?
No, let me see if I can play it here.
Okay.
Because the presentation is open here. I just need to reach that point. Oh my God. Like we can just hear some background noise.
Okay.
Now, like nothing here too.
Yeah, okay, that's okay. The good thing about this slide is it actually has the script right on here. So I can just read it. I can read it right here. Okay, so here we have, now I think you're ready to start exercising again. I'd like for you to go for a walk each day, just a few minutes to begin with. It's important for your recovery and also really good to help with your anxiety. How does that sound? I'm not sure I feel ready to walk on the street. There's nothing to worry about. Just a few minutes each day will be so good for you. Now, let's talk about your physiotherapy. So if we look at this, the answer is yes, right? She doesn't really explore the patient's concern. Instead, she moves right on to the next topic. She's not asking any questions or trying to explore anything here, okay? So how could she explore the concern, right? Think about that for maybe 20 seconds. What would be a better way for her to respond that actually is exploring the concern? All right, so feel free to write your ideas in the chat. So this is one example you could use. I see you feel vulnerable walking alone. I can understand that. So, how about we get someone to join you? A friend, perhaps? Oh, that would be good. Okay, so that's one way that we can explore the concern. As you heard, she explored his concern with an open question. She paraphrased his feelings, showed empathy, and offered a suggestion related to his concern, right? So those are kind of ways of making sure that you can explore the concern. Using an open question, what worries you about walking on the street? Paraphrasing the feelings, you feel vulnerable walking alone. Showing empathy, I can understand that. And offering a suggestion. How about we get someone to join you, a friend perhaps? Let's move on to the third way you can improve, and that is to use appropriate questioning techniques. Understanding how to choose between open and closed questions at different points of the interview is important in the patient-centered approach. An effective healthcare professional uses open questioning techniques first to understand the problem from the patient's perspective. Later, the approach becomes more focused with increasingly specific and then closed questions. So starting out with open and then moving to closed. First, let's complete these questions you might find yourself asking in consultations with patients. So take 30 seconds to try to complete these sentences. All right, here we go. Can you tell me a bit more about the pain? Do you find the pain worse at certain times of the day? What have you done to manage the pain so far? So, what brings you here today? All right, so those are the questions you might find yourself asking.
So would you say it is nice to mix like indirect and direct questions?
I think so too, yeah. But besides using like open and more closed, you can also consider using direct and indirect. It can be a mix of both. Absolutely. So now let's put these questions in logical order. All right, I'll give you 20 seconds to try to put these in order. Think about you're asking a patient these questions. Which one would you ask first, second, third, fourth? All right, here we go. So the correct answer here would be D, A, C, and B. So again, you're starting out with those open-ended questions, then you're becoming more specific and ending up with the closed questions. Okay? There are two types of questions you should avoid, and those are compound questions and leading questions. Compound questions are when you ask two or more questions in one go. The problem with compound questions is that they lead to ambiguity. The patient may not know which aspect of the question to answer, right? So for example, are you sleeping well and getting enough exercise, eating healthy? Which part of the question are they answering, right? If they just say yes, you're not sure what they're referring to. And a leading question is one that pushes the patient to a particular answer. They're a part of the criterion information gathering. It is occasionally appropriate to ask leading questions when you're confirming information with a patient. You were recently diagnosed with diabetes, is that right? So when you're confirming information, it's okay to be leading. But if you're trying to get information from someone, you shouldn't be leading. You're taking the tablets twice a day, right? You might lead them to say yes, even if that's not the case, just because of the way that you format the question. So definitely something to think about. Being aware of the types of questions you're asking is important, as you can easily change your questioning once you know what you want to do and what you should avoid. Change this leading question to an open question. Post your answers in the chat. So how would you change this leading question? You're not exercising much to an open question. Take about 10 seconds for that. All right, so the answer here would be, how often do you exercise, right? That's a way of making this an open question. And this one, the leading question is the rash sore or itchy or bumpy? How would you make this into an open-ended question? An answer here could be, can you tell me about how the rash feels? Right, so you're still getting that information from them, but in a different way, more open way. The next way you can improve in the speaking subtest is by chunking and checking when you give information to the patient. Let's see what it means to chunk and check information. I'm going to play an audio, and you need to tell me if the speaker pauses enough and checks the patient's understanding. So you know what? Actually, this one I don't know if I wrote the script for this one. So let me see if I can maybe just read it. Okay. So what I'd like you to do is visit the community health center. There are classes there, exercise classes and relaxation and breathing classes. I'd like you to try a few classes, 2 or 3 a week for the next few weeks. Also, I'd like you to make an appointment with a dietitian. So based on what I just read, do you think the speaker pauses enough and checks the patient's understanding? Right? Based on this, based on what you heard, the answer for that would actually be no, right? They didn't really check for understanding. She just goes on with everything she has to say without really checking for that additional information.
And this is something students need to be careful about because they get nervous and they just want to like do their part and they forget to listen to the other part. So be careful, guys.
Absolutely. Information giving is one of the clinical communication criteria. So, establishing initially what the patient already knows, pausing periodically when giving information, using the responses to guide steps, encouraging the patient to contribute reactions, feelings, checking whether the patient has understood information, discovering what further information the patient needs. So how could she give that information more effectively, right? What's a way that maybe she could give that more effectively? So I'm going to play the same conversation again, but this time the speaker does things a little bit differently. So tell me in the chat what she does differently. So I'm going to read it again. So what I'd like you to do is visit the community health center. Do you know where it is? The patient says, yes. Then she continues, there are classes there, exercise classes and relaxation and breathing sessions. The patient says, okay. She continues, I'd like you to take a few classes, 2 or 3 times a week for the next few weeks. Would that be manageable? The patient says, I'm not really sure how these classes will help. She continues, it seems like a small thing, I know, but these activities can make a big difference to how you're feeling, and lots of people find a big change to their anxiety levels. The patient says, okay, that makes sense. And she continues, so do you think you can manage 2 classes a week? The patient says, yes, I can do that. So if you think about what she did, she asked about what he already knows, she paused, she invited him to contribute and checked for understanding with questions, right? She said, would that be manageable? So all those are things that she did. And the final way you can improve your speaking is by staying away from pre-rehearsed or memorized phrases. Okay, you want to stay away from these. In an attempt to reassure your patient, you might use phrases that sound empty without meaning to. What you should do instead is listen, accept, or acknowledge the patient's view, and then offer reassurance based on what you have heard them say. So just empty or premature reassurance would be, don't worry. You don't worry about that. Nothing to worry about. So for example, if someone says, I think my father is dying, don't worry. You don't have to worry about that. Instead, you should listen, accept, and acknowledge the patient's view, right? So I'm worried I will have a scar forever. Something you could say is, I absolutely understand that you're worried about that. This particular surgery can leave a small mark, but there are lots of ways to help prevent scarring, which we will go through. Checking that a patient has understood something in a mechanical way can prevent the patient from telling you if they have actually understood. You can check more authentically by using more natural expressions or by personalizing your checking based on the information you have shared. Right, so you're avoiding that mechanical checking, and you want to check more authentically. In the same way, formulaic or memorized phrases for empathy sound empty and may have the opposite effect. Instead, be specific, echoing the patient's feelings, and personalize what you say. Okay, for this activity, we're going to try and see if you can recognize some of the skills we just saw. So I'm going to play part of a role play where a nurse is talking to a patient. Take notes as you listen and notice what clinical communication skills the nurse demonstrated. All right, so I'm going to go ahead and read this. Hello, Dina. It's me, Nurse James from the clinic. I'm here for your checkup and to see how you're feeling. How are you feeling today? Actually, not great today. Oh no, that's no good. Can you tell me what you mean by not great? Well, I got this sore spot on my back, my lower back, and I'm worried it's a bed sore. All right, I can see you're quite uncomfortable. So let me ask a few more questions before I have a look, and we'll take care of it, all right? Okay. So, you said you've got a sore spot on your back. Can you tell me how it first came on? I guess I noticed it yesterday, and it's sort of a sore spot at the base of my spine. Okay, so you just noticed it yesterday, and it's down low on your back. Can you explain the pain to me? It's itchy, and it feels kind of firm and warm. Firm, I see. That must be uncomfortable for you. Yeah, I'm quite worried about it. I can appreciate that, especially because you've been in bed for a while now after the surgery. So I'll have a look in a moment, but it does sound to me like a pressure ulcer, which is just another name for a bed sore. You mentioned that name before, so how much do you already know about bed sores? So thinking about that, what did the nurse display? He initiates appropriately by introducing himself and his role. He explains the purpose of the visit and asks an open question. He shows empathy. Oh, that's no good. Asks questions to clarify. Can you tell me what you mean? Uses signposting language. Let me, before I, summarizes what the patient has said, demonstrates active listening, shows authentic empathy, and asks what the patient already knows about bed sores. Let's finish with some resources to help you improve your speaking for OET and beyond. So the first thing here would be the OET sample tests on the OET website. Most other tests only give you some sample questions for free, but we're very proud to provide complete sample tests so you can really test yourself before test day. You can download the sample test and use it to practice in person with a friend or colleague. So if you're using the paper-based or practice via Zoom or other social media, which is the format that you might use for the computer-based or OET at home. So you can practice depending on what version of the test you're taking. These two booklets explain the assessment criteria OET uses to score your speaking. They are full of helpful explanations of what the assessors are looking for and useful language you can include in your role plays. They include more examples of this nurse we heard in the webinar completing this role play, as well as a doctor and a speech pathologist completing the role play specific for their profession. So you can hear where each one demonstrates strengths and weaknesses. And again, you can find these on the OET Ready speaking page. Before moving on to take any questions, I would like to offer some extra tips to consider when preparing for OET speaking. The first would be imagine speaking with patients in various settings. At the hospital, in their home, in a clinic. Ask a friend or family to give feedback. Choose a friend or family member to role play with. Explain the skills you need to demonstrate. Ask for their feedback. Use resources on OET.com and OET's YouTube channel. So, for example, we have a sample speaking test video on YouTube that you can watch. Record yourself, listen back, and evaluate. You can do this to try to self-evaluate your speaking abilities. Make a record of different phrases, which you could apply or adapt to different situations. Pay close attention to functional English, such as advice, explanations, questions, empathy, etc. And lastly, consider working with a teacher for expert guidance to identify your weaknesses. So the last thing I want to mention here is our OET YouTube, or I guess our social media accounts in general, that you can use to connect and learn more about OET. So you can follow us on Twitter/X, LinkedIn, Facebook, and YouTube at official OET. So definitely feel free to check us out. Okay, so that's actually the end of my presentation here. So I'm going to stop sharing the screen and turn it over to see if anyone has any questions.
All right, guys, do you have any questions? Thank you for the invaluable information you shared. It was extremely helpful. The presentation was well organized and very clear, even though you brought like um, complex content about the exam, but in a simplified way, always. And I think that something students need to keep in mind is that the exam is patient centered. Because if they keep, guys, if you keep that in mind, it will be easier for you to decide on the language you need to use, the questions you need to ask. And do you have any final pieces of advice to give students when preparing for OET, perhaps like common mistakes to avoid?
I would say we covered a couple of the things already, like making sure you're using the right register, not formal vocabulary, making sure to show empathy when working with the patient, not just getting through the task as fast as you can. I think one thing to keep in mind is that you don't necessarily have to finish all the tasks to get a good grade. Instead, you should really focus on being clear and thorough when completing the tasks rather than rushing through them. So I think those are kind of some of the final things that I would mention.
All right. Okay, great. So, guys, if you don't have any questions, we can stop here. Thank you very much, Jack. And we will be here again next month, right?
Yes, we can definitely do some more workshops, plan some more things to kind of continue along with the OET preparation sessions that we've been doing.
Yeah, so we're gonna have a class about reading and then listening. And guys, Jack shared something like really interesting with me in our last meeting. He told me that a lot of students are getting very low scores in listening and reading. And I believe this is because most of you underestimate these skills.
Mm-hmm.
You are like studying so hard for writing and speaking that you don't practice enough for listening and reading. And then you end up like getting the lowest grades in these two areas. So be careful. We're going to have workshops about these skills to try to help you with that. But it was like something that surprised me because I didn't expect that at all. But when Jack told
Mm-hmm.
me that, I was like, okay, that makes sense. That makes sense.
Absolutely, definitely skills to keep in mind so you can focus on those in the next few sessions as well.
All righty. So thank you very much, Jack. Have a great night
All right,
and
you
a
as well.
great weekend. The weekend is coming. We're
Yes,
almost there.
definitely. Almost there.
All right. Guys, bye bye. Thank you for being here with us. See you
Bye,
soon.
everyone.
Bye bye.